Hey everybody, this is Shelby Blankenship, one of your MMOA TAs and a physical therapist. I am going to be talking to you guys about my personal experience in going from being a hospital employee to paying hospital bills because I had to get admitted twice. So just a little background. In November, right around Thanksgiving, my mom was diagnosed with breast cancer and we actually had to go get a port put in and start her on chemo. I had quit my job at a local hospital to open up Stave Off, which was a geri outpatient gym that I'm sure you've heard Christina talk a bunch about in the MMOA. And then I miraculously got sick, and originally it was just the flu that we thought, but ultimately over about 3 weeks, I had a fever of 102, could not get out of bed. I was trying to open Stave Off, and the next week I literally had to open and had a ribbon cutting ceremony. So, long story short, they thought it was the flu. Then they thought it was bacterial pneumonia, which was when I was hospitalized the first time because my heart rate was 120 at resting. And not many of you know me, but I do CrossFit 5 times a week. The past 2 years, and before that, I was doing more of like a functional fitness, boot camp style for lots of years. I had really gotten strict about my diet. I was doing wild health. I was really like getting nitty gritty about taking care of myself. And I'm only 32. So I know sometimes the wrinkles don't show it, but I am 32. The past 3 months have aged me a little bit. But going on to that, I just didn't understand what was wrong with me. All the doctors didn't understand. They're like, you're a very healthy individual. We just think it's the flu or we think it's pneumonia. And it had gotten to a point where I basically hadn't eaten. I had lost about 15 to 20 pounds. I was just not doing well. I couldn't run my business. I couldn't do anything. I was just stuck on the couch. And eventually, because my oxygen saturations had gotten to a point where they were at 90 just at resting, I had to go back to the hospital for a second time. This time, I really strongly advocated for myself to get infectious disease and pulmonary. And thankfully, I had worked at the hospital that I was going to, so I actually knew most of the people personally. And so that was helpful in the advocation avenue. But it was a journey. I had to have a bronchoscopy. And then ultimately, that showed that I had fungal pneumonia, which the specific type is called histoplasmosis. Most of you have never heard of that. That's something that like our grandparents had way back when. It's one of those diseases that most people can fight off on their own and it's never an issue. But I had the compounding factors of flu, bacterial pneumonia, and fungal pneumonia. Lucky me, like a Griswold. But after they got the bronchoscopy, they were severely concerned about it impacting other places of my body. So I had to do multiple CT scans because they thought I might have had a PE, because my D dimer was elevated. They also had to do a lumbar puncture because they were really concerned that I had meningitis or potentially getting that because of my lab values. My platelet counts were all over the place, and I was having to be put on oxygen. And I had to be at the hospital for at least a week, which if any of you have worked in acute care, most stays are between 2 to 3 days. They try to keep it short and sweet and move you on to the next thing. If you're there for longer than that, either A, your surgery has gotten delayed, or B, something is severely wrong with you and they're really having to like monitor you. So ultimately, they finally got me on an IV drug called amphotericin, which is known as amphoterrible because it's basically like chemo. It's super nasty. It's basically poison going through your body, trying to kill this fungal pneumonia because I had spores throughout all my lungs. There's only one set of lungs. Throughout my lungs. And then I had bacterial pneumonia in the right upper lung. And then I also had it going into my spleen and other areas of my body. They started treating me with steroids as well because they were concerned of the meningitis, that maybe the lumbar puncture didn't show anything, but just in case. So throughout that whole journey, I again told you I lost quite a bit of weight, which was all muscle, which was very frustrating. I could barely get myself to the bathroom, which was maybe 10, 12 feet. I had to be on oxygen at all times. I required my mother-in-law to help me take a shower on a bedside commode. And after the lumbar puncture, I could only tolerate it for 10 minutes. And then I had to go lay down because my head was pounding so bad. I mean, it was incredibly painful. It was really, really tough situation. My in-laws and my husband were having to stay with me at night because one of the drugs they put me on said that it could make me hallucinate. Fortunately, I did not do that, but it was wild. And I can tell you that just laying in that bed is one of the worst experiences I've ever gone through. My back was hurting so bad, and I don't know how much of it was from the lumbar puncture or just not being able to move like I normally do. Getting to a bedside commode was awful. I was constantly on IV drips or taking meds, and they were waking me up every 2 to 3 hours. So of course my sleep was just erratic and not, helping in the healing process. And it was really hard. So all that to say, everything that we learn in MMOA not only applies to our GERI population, but it also applies for anybody who's been on that acute hospital side when they have this dramatic shift of being, being able to do their normal ADLs or being in that fitness realm and then quickly and dramatically transitioning to the sickness realm. It's terrifying, not only from a patient perspective, especially when things aren't hot, and when you're looking at your family and they're very concerned, because I'm not gonna lie, I was totally in denial. I was like, it'll be fine. Everything's gonna be fine. And it was not fine. So I'm really thankful that I had quite a few people there to come and check on me. And I had lots of people just praying for me. And it was a very hard situation. But I wanted to touch on 4 things specifically that I feel like I learned throughout this. The first is 1 rep max living. I have fully experienced that. I used to be able to deadlift 270 pounds 2 months before this happened. And after this duration, I finally was able to get back into the gym in February. I did a version of a 1 rep max, and it was 135. And it was ugly. It was real ugly. So that I understand, being able to just only be able to get to the bedside commode when that totally tanks you. I get it. I totally get it. Community. I don't think people realize how important it is when you have that very large transition of fitness to sickness, how much you need your community, not only from a meals perspective or just a psychological comforting perspective, but we had basically left everything to open this place. Financially, we were screwed. I didn't know what we were going to do. And there was nothing physically I could do. Had reached the point where, and I hate asking for help. Just ask my husband, ask anybody that knows me. I hate asking for help. And I had gotten to the point where I literally needed help to do the most basic of ADLs. It is a very humbling experience, to say the least, when you get to that threshold. Advocating for yourself is the third one. It took me 3 weeks to finally figure out what was wrong with me. And I was calling my PCP. I was going to the urgent care. I was calling my NP friends. And I knew something was wrong. And I didn't know what it was. It was beyond something that I could control. And it was definitely beyond something that I could just will myself to be better, because I definitely tried that and it did not work. And it is one of those areas where you just feel like, how did I get to this point? How did I go from being, feeling like Mighty Mouse in one realm to being literally like a mouse? I couldn't do anything, and I was just helpless. So just making sure, one, that you have the ability to advocate yourself and be knowledgeable. And sometimes most of our patients don't have that capacity. And so you have to advocate for them, or you have to equip their family to advocate for them. And so those little extra miles and measures are so helpful. I had a case manager that I used to work with and she's amazing. And she was the one who helped me get out of the hospital within a week. Because if it wasn't for her, I probably would have been there 2 weeks. And they weren't necessarily concerned about me medically having to stay longer. It was setting up the home health, setting up my meds being transported to my house, teaching my husband how to do my IVs because I had to have a PICC line and we had to do infusions for 3 weeks after I had gotten out of the hospital. And just setting all those things up. If you don't have people in your corner, I mean, you can just feel totally, totally lost. So the more that we can advocate and really look at that holistic approach and have those, those sheets of paper where it's like, hey, if you need help with medication management, here are the people I recommend. If you need help with just transport, here's what I recommend. Because I couldn't drive. I was just getting so dizzy, and I felt like I had severe ataxia just trying to walk or anything. Even sitting up for more than 5 minutes was too much for me when I got home. And so I had to rebuild to that point. And then the last one, which I kind of just touched on, is sickness to fitness. So this whole thing started in right after Thanksgiving. I was able to go back to the gym February, and I had lost a lot of weight, lost a lot of muscle tone, and I had to start over. I started back with snatches with just a PVC pipe. I was having to just moderate everything. I was having to watch my breathing, watch my heart rate, be just super mindful of what my physical capacity was versus what my mental capacity was. Because mentally I was like, yeah, it'll be fine. I can just go back to doing what I used to do. And when you try and it's humbling, you just realize I've got to start slow and do very calculated progressions so I don't end up back in the hospital. Because there was multiple times where I would push it too hard, and then I'd have these nausea and vomiting bouts with the medicines, or really bad dizzy spells, or just absolute fatigue. And it was awful. It was just so, so awful. And I hope that I hope you never have to experience that. But if you ever are at a course and I'm there, I'm happy to talk about anything that I went through. Some of it was, I have to laugh about it now because it was just so ridiculous. I had to literally transport myself over from the bed to the operating table for my lumbar, for my bronchoscopy. And they were supposed to, knock me out, and they didn't knock me out. And then they started strapping me down. All four hands and arms and everything to make sure I didn't buck off the table during the bronch. And it was just, it was one of those things you just, you can't make it up. You just can't make it up. So all that to say, those 4 aspects of 1 rep max living, community, advocating for yourself, or having somebody to advocate for you, and then that transition to sickness to fitness is not just for our Geri patients. It's something that we might experience at some point. I hope you never do, but it is a humbling experience. It is one that makes you identify more with your patients and gives you more empathy for when things just don't go the way that you think they're going to go. And if you look at my personal page, I even wrote a letter to myself, to my body specifically, about how mad I was at it for failing me, because I just felt like it had just totally given up on me. I had put all this effort in and really tried to maximize it to its full capacity, and it didn't do what I wanted it to do. And then if you look at the second page, you look at a letter that I wrote from my body to myself. And honestly, that was a very good exercise for myself. It'd probably be a good one for your patients, but it made me realize that all the years and time and effort and money that I put in to keeping myself in that fitness and optimization period ultimately kept me from, 1, staying out of the ICU, and 2, even my infectious disease doc said if I hadn't been as in shape or as young as I am, I might not be here anymore. And that's a humbling statement. So just know, and this is something I would tell all our patients, it's always worth it. It's always worth it to invest in your health. It's always worth it to really push yourself to see what your maximum fitness capacity is, not only from an exercise perspective, from a diet perspective, sleep, recovery, getting all that together and optimizing that. So when things like this happen, you are equipped for it and you can actually handle it. It's funny, my mother-in-law even told me that when she was there helping me and, watching me, she goes, if this takes you out this bad, I cannot imagine what it would do to me. And so that's why she works out in my gym 3 days a week. So all that to say, I hope you never have to experience that personally, but you can use my story to help with how to advocate for your patients and give them that full framework of why we really strive for that fitness forward approach and how important it is to have that holistic group of people surrounding you to keep you in that realm. Just to touch on a few things as far as MMOA specific things, there's 2 MMOA lives going this weekend. One is in Lake Elmo, Minnesota, and one's in Adventura, Florida. And then the next weekend, the 18th and 19th, there's one going on in Cincinnati and one in Fayetteville, North Carolina, which I will actually be at. So if you're there, please say hi. And if you have any questions about this story, you're more than welcome to send me a message. I'm pretty much an open book. But I hope y'all have a great day. I hope this was helpful for somebody, and feel free to share it along to anybody who you think would need it. Thanks, y'all.